Hello everybody, I am Dr. Rehan Sabir. I am a general and endocrine surgeon at Maven Medical Center, and this is a daycare surgical facility in the heart of the city of Hyderabad. Today we are going to talk on the topic of pilonidal sinus. Pilonidal stands for the nest of hair, and this disease is usually seen in the younger age group, both in males and females. And the location where the pilonidal sinus is very commonly seen is the lower back. It is a sacrococcygeal area. There are other sites where the pilonidal sinus are also found. For example, the web space of the fingers, the web space of the toes. Even in the umbilical region, we have seen pilonidal sinus on the umbilicus. We are going to talk about this most common site, which is at the lower back at the sacrococcygeal area, where the patient will present to us with a swelling and the discharge of pus and blood. And when they come to us, they come in acute condition, and some of the individuals, they come after a long time, like after 6 months and 1 year, by the repeated infection, where they form actually sinus. When we examine these types of patients, we find the nest of hair. There is a dead hair is there. There's their own hair which finds its way into the sinus and causes the infection. So basically the pilonidal sinus is the infectious disease. It is not a malignancy, it's not a cancer, so nothing to worry about that. But the only thing is that it is an infectious disease which is caused by the patient's own body hair. This hair, they fall down and from the neck, from the back of the neck or from the surrounding skin area, and they causes infection inside. They bury the hole there and they make an infection there, causing an abscess. These patients, when they come to us, usually they need a surgical procedure for that, because once the infection has set in, no matter what antibiotics we give or any other medicines like anti-inflammatory, the infection will not come down unless and until we remove the nidus of the infection, the focus of the infection. So that is a dead hair. So when we do a surgery for these patients, usually we find a lot of dead hair is there inside the sinus. And we at Maven Medical Center, we have been doing the surgery for the pilonidal sinus for quite a long time, and we have fortunately get the successful results. We do both by open method as well as we use the diode lasers for that, and the results are equally good in both the cases. We have been doing this for the last 10 to 12 years in the Hyderabad city. The pathology, many people ask us what could be the reason why this occurs. So usually we see it only in the younger age group. The reason is that in the younger age group, the texture of the hair is very hard. The texture of the hair is very hard, and when this hard hair finds its way and burrows inside the skin of the individuals, it causes infection. It is very rare to see this pilonidal sinus above the age of 40 years, because the reason is that above the age of 40 years, this hair will become very soft and doesn't have enough strength to pierce into the skin and causes the infection. So once we operate on these types of patients, we usually give them advice to keep on shaving that area more frequently, once in 15 days or once in 10 days. So they should not let their hair grow surrounding that area, and they should avoid sitting for a long time, because we have seen these type of patients who have been into a profession of sitting for a long time, like the drivers, car drivers, bus drivers, and those people who sit for a long time in the front of the computers and all. So because apart from those individuals who have got a very hairy body, these individuals who are into this type of profession, which makes them to sit for a long time, so due to the constant friction and the sitting posture, this hair will find a way inside and causes infection. So if you know anybody who has been encountered with this infection and is suffering for a long time, kindly please do guide them to come and visit us, and we will examine that patient and we will do the best for him. Thank you so much.